Katie, you say the GOP's health care bill is a jobs bill.
Yeah, I think that we've already seen that. I think that the effect of Obamacare on the economy and jobs was certainly downplayed under the administration. There was very little GDP growth, and I really do believe that that was tied directly to Obamacare. We're already seeing small businesses talk about the fact that they're excited about regulations and taxes going away, and these mandates such as, if you have more than 50 employees, you have to provide health insurance to your employees. And so they weren't hiring because they don't want to go over certain thresholds that were laid out in the Obamacare legislation. So they're positive about it. You talk to small business owners, they say this is one of the biggest wet blankets on the economy, and they're looking forward to it being gone.
That employer mandate, Jonas, it actually encouraged companies to not hire full-time workers. It encouraged companies to hire part-time workers in order to avoid that 50-employee threshold.
Well, by that logic, if it was a really good jobs program, there would be no more coverage by employers at all. The fact that any time an employer has to buy you health insurance, you're going to slow down hiring. So that's already not a great fix. That said, some of these changes will improve the job market compared to Obamacare because there are some pieces of it that make it difficult to hire workers. And it seems like the government's going to be making up the difference with borrowed money and taxes, which in some way will keep the jobs in health care. And I don't want to say, I don't underestimate this plan. Obamacare created a lot of jobs in healthcare. You gave millions of people insurance that they then went out and started spending money on stuff that they weren't doing, which is one of the reasons premiums are going up. So it's going to keep that piece of the equation, yet take away the part that employers have to deal with, which is a negative to jobs. So it could actually be a bigger boon than before.
John, will it create jobs? Because it surely will lift a burden that many businesses, small and large, have felt.
It will lift a burden to some degree. I agree with Katie when you talk about regulations and taxes that have stymied this economy. And I think Obamacare has hurt this economy some. I just don't think this is necessarily a fix because you're not doing anything to fix the real problem. All you're arguing about with this is who pays. So the problem is with health care. Obamacare never addressed health care. All you did is arguing who pays. You stick a bunch more people under Medicaid. There's 70 million people under Medicaid right now. Now you're shifting that Medicaid burden back to the states. The states are not going to be able to handle that burden. Why is taking an aspirin pill, a tablet, in a hospital cost $8 or $10? Why does a procedure in one hospital cost $10,000 and another cost $50,000? We need a fix for health care. This is not a fix for health care. This is all about arguing who pays, which does nothing to fix the problem.
But in terms of jobs, Gary B., the GOP plan coming out of the House, it does cut taxes in many ways. It gets rid of this additional investment income tax for wealthier Americans, this additional income tax for wealthier Americans. That will give them more money to spend.
In theory, Dagan. I'll look at the flip side. I think what John hit on was that this fix was more of a health insurance fix versus health care. But let's look at it from a jobs perspective. Why did Obamacare, and I disagree with Jonas, not help the jobs market at all? Because it was a burden on us all. So now you get rid of the individual mandate, you have tax credits. But where does that money come from? It still comes from us. But the bigger part of why it was such a drag, and it still is a drag, Obamacare versus whatever we're calling it, Trump care, is that you still have the government heavily involved with 1/6 of the economy. When you put that monkey wrench of the government inside the flywheels of the health insurance industry, making them still insure people, children under the age of 26, making sure people with existing illnesses are covered, making sure they still have all that Cadillac stuff, you are making a major efficiency charge against the health insurance industry. I don't see how you can do that, sticking that broomstick handle into the health insurance industry and hope to see jobs rise. I think when you affect 1/6 of the economy and just by moving money around, as John implied, I think you might actually hurt jobs. You're not going to help jobs versus Obamacare.
But Chuck, this GOP plan, it does lift a major burden off smaller businesses, and you being a small business owner should understand that.
Well, I think it's going to help a lot of people get jobs. Listen to me here. They're going to need to get 2 or 3 more jobs to afford the health care now. So that's what I'm thinking. Now, a small businessman like me, you're right. A small businessman like me, you're exactly right, Dagan. My health care is probably going to go down. To John's point, it's just shifting the burden. It's who's going to spend the money now that's actually going to help the economy grow. It was helping poor people a lot, and folks like me in the middle who had a small business, it burdened me. My health care went up. Now my health care is probably going to go down, and poor people's health care is going to go up. Who's going to go be looking for jobs? They're going to go need to get an extra job to pay for their health care.
Well, poor people get Medicaid first and foremost. And Katie, I'll just point to one of the taxes that's going to go away. The medical devices tax in 3 years destroyed about 29,000 jobs. That is out of the Commerce Department. That is 7% of all medical technology jobs in this country. Destroyed.
I'm so glad that you brought that up, because it's not just the 29,000 jobs destroyed now, but that is an industry that needed to look into the future with engineering jobs, students going into engineering to go into the medical device industry. And what are the consequences of that now as a result of them not going into those fields because of this tax that was put on through ObamaCare? And the other thing is that this may not be a direct jobs bill in the sense that, sure, it might not create growth right away, but when you look at the other implications that this will have, if this bill can get healthcare costs down, if it can get premiums down, that means people are going to go out into the country, spend more money on tourism, more money on travel, more money on everyday spending that they weren't before because their premiums went up. And inadvertently, that spurs more growth for businesses to hire more people because the economy as a whole is growing. So the strategy from the White House is get the economy as a whole growing, repeal and replace Obamacare, and that will then, in effect, create more jobs.
John Layfield, I dare you to disagree with her.
Look, I agree about fixing the economy, but that's the morass that President Obama got in as well. Look, President Obama first dealt with health care in a 100% partisan fashion, and because of that, the Republicans wouldn't work with him the last 7 years. The Trump administration right now, it looks like they might be falling into the exact same trap. Fix the economy. Look, if you fix the economy with the tax reform, the regulation reform, the health care reform, you can do that at any point after that because you'll have the political capital because you fixed the economy first. I'm not sure they're getting trapped in this health care mess just the same that President Obama got trapped in 2008.
But, Chuck, if you look in this bill, it alleviates so much taxing pressure on small businesses, or at least regulatory pressure, because it rolls back all of these taxes, or at least kicks them down the road, like that Cadillac tax. That gets kicked down to 2025.
Look, as a Democrat, I'll tell you and be the first one to say Obamacare wasn't perfect. This bill is not perfect. They should be figuring out a way, to John's point, to do something that does help create jobs and doesn't stifle jobs, that doesn't stifle small business people like me. But you're talking about them doing something that's almost impossible behind me. It's two common sense people coming together and trying to fix something. Well, ain't nobody behind me got no common sense, and that's a problem to begin with.
But they do listen. They absolutely do listen, particularly President Trump, to all those small business owners. And time again, Jonas, they say, our biggest concern is health care. Our biggest burden is health care. This bill alleviates that.
Well, some countries have it good because there's a single payer and the employer doesn't have to pay for any of it. But I will say that you're just moving. Look, it's great to get rid of these taxes on capital gains that Obama kicked in and the mandates. But at the end of the day, if you're keeping the part where you have to take on as an insurer somebody who's very sick and expensive, that cost is going someplace. It doesn't seem to have been figured out yet, but some other tax is going up or someone else's premiums are going up because it's uneconomic to insure people with no caps who are already sick, and that part's staying. So I don't see, you're like, oh, the guy selling stock who was making money, yeah, he's going to get a less tax, but someone else is picking up that health care tab.